how many are on methadone or whatever drug treatment? You never mentioned that.
Nobody's going to be on drug treatment. Now, will some of the people in the house be on methadone? Some of them may have mental disabilities such as personality disorder. Some of them may be depression. Some of them may be because of the age that we're dealing with. Some of them may be in early stages of Alzheimer's. Some of them may have early stages of dementia. Some of them will have substance abuse histories, without a doubt. I'm not going to lie to you about that.
Sir, how many are ex-convicts?
And sex offenders?
None.
Second question is, do you live in Frankfurt area?
No.
So why is it that you decide, why is it that you say, because you know, I think a lot of us who live around here, we're kind of tired of people trying to come to the neighborhood and exploit our neighborhood with these kind of programs, because there are hundreds of programs in this neighborhood. So why another one? Why in Frankfurt?
Well, first of all, I've been in Philadelphia all my life, and I lived in
so
why is
it not
because the property that, as it was advertised as a rooming house.
So there's no properties around where you live?
Well, the property, when you buy property, you look for the best deal. That was the best.
So it's Frankfurt.
It was the best deal we could get,
So yeah,
to be honest.
I think
A couple questions. So I think we're having two conversations here. We're talking about what you want to do, but I want to talk about what is current. So what licenses do you currently have? And I heard you mention the state, you're regulated by the state. Which department of the state are you currently regulated, and do you currently have a license for this property?
No, that's in process. The property, before it gets licensed, has to...
Who's the application in with?
The application would be in with license and inspection.
There's no license and inspections at the state level?
No, for the facility.
Okay.
Under the...
So this is a personal care boarding home?
Right.
Right? So I'm clear about the conversation we're having. You're asking to open up a personal care boarding home.
Right.
From the state, which department?
The Department of Health and the Department of Public Welfare.
Okay. All right. So do you currently have that license, or you have one submitted?
We're currently going for that license.
Okay.
And the only way you can get that license is if you actually have a facility.
I'm very well aware of
okay.
how to obtain one of those. So your clients will come from where again?
They could come from the hospital, they could come from the Office of Mental Health, they could come from the state level. The state has a procedure where they refer people to licensed care boarding homes. And there's an assessment given based upon what the boarding homes admission criteria.
What would your population max be?
I think it would be, we got like 5 bathrooms in there. I think it would max out at, you can have like 7 people per bathroom or whatever. But five of the bathrooms we have, one of them would be dedicated to staff. So it would be something like 4 bathrooms. So it might limit us to 24 people.
Okay, so again, talking about sort of what you hope to do and where we are.
Okay.
Here's where we are as a community, from the protest to, you know, the different things about what this would be. First, you know, there were 6 different stories about what it would be. You know, something was told by people that were working there. Something was told by you to the young lady that lives next door. So here's where we are, is that we are against a recovery home. At this point, we are not clear what you're saying about a personal care boarding home, so we're against that. But one thing you could do is that what it was originally zoned for was 11 units of apartment housing.
It was also zoned as a rooming house.
No, it was not.
That's what the
no, it was not. Well, we would be against that. We would be against that as well.
Okay.
But what I would say from a business perspective to you is that it's zoned as 11 units.
Mm-hmm.
We are against those other things.
Yes.
And we would be willing to take a vote on the others, or on the other part of it, the 11 unit piece of it, but those other things we are currently against. Because there's just been too much circular talk and conversation about what is, what you're trying to do, and what have you. Where we are is you don't have any license currently. So what I would ask is that you stop pursuing those licenses and pursue another business in this community.
Yes.
just to get this the affirmative statement out of the pastor here, how many people that you intend to put in this building? Is it a maximum of 24?
It would probably be a maximum, but the state will make that determination.
Can you give us, at least the community, a commitment on the maximum number of people that you would intend to put in this 11-unit facility? If you were to have your way with the boarding house, just for the sake of argument, you got your way, how many people would you cap it at if you could?
It would be capped at 24.
So you're going to commit to the community tonight, before all these people here, that you'll put no more than 24 people?
That's how many bedrooms.
Okay.
That would be available.
But if you had your way, if you were able to modify and get any zoning variance you possibly could, how many people would you put in that building?
24.
24 is the maximum. And also, just two more questions, because we gotta get it clear. Are you committed to the community not to perform any work during the time frame that there is a cease work order on the building?
Absolutely.
You're committed to that?
We are willing to have an advisory board of citizens in this room to help us develop a plan that would be palatable to you.
We had an opportunity to go into the house, to look at some of the work that was done. The work sucks. I don't know another word for it. I don't know another word for it. We went in there, we shook windows that looked like they were gonna help me.
Ball out.
Okay, thank you. So, I mean, it's a brand new window in a rotten frame. That just says to me that the quality, of the work, of the facility, whether it's a boarding home, a drug rehab, or an apartment, the quality of it is not at a standard that is decent. The windows are shaking out of the frame. So, I mean, we have to start with some, I don't know, integrity, help me people, I need a word.
Don't rush it, take your time.
Thank you. I mean, there has to be a point where I believe, I would love to see a point where not only do we agree on what the property will become, but also agree on the standards that your company would set for your residents. That is so important, because no matter what you put there, and no matter how well you run it, if the facility itself is falling apart after the rehab, then what do you have? We haven't done anything.
I agree with you all.